Station.
Yes, ma'am.
All right. So if you've read and understood considering it communication skills station, please begin.
Hello, Mr. Adam. I'm Dr. Iqbal. I'm the surgical doctor taking care of you. Today, I have been asked to talk to you about an investigation we would like to arrange for you. Can you please tell me what do you know so far about this investigation?
No, but no one told me anything till now. I know nothing. Which
Okay.
investigation?
Okay, no worries. I'm here. I will guide you everything about this investigation. Uh, this investigation we call this investigation is esophagogastroduodenoscopy, and which is also abbreviated as OGD. So what we will do, for example, if this is your mouth and this is your food pipe and this is your stomach. So what we will do, we will insert a camera, which is called the endoscope, through your mouth, and it will go down to your food pipe, and then in your stomach. So this camera, which we call endoscope, actually relay the image on the screen, and
You can
along with that,
draw.
we can see. So we can see what's inside. Once we can see from inside as well. So along with that, we will also do some dilatation, which we call widening at the narrow part of your food pipe, which was previously discovered by your barium swallow. And there may be a need that we will also take some sample from the lining of your food pipe, so that it will help us to make the diagnosis of your case. Are you following me?
Yes, doctor. I have heard you as far as this, but it sounds really scary. He's joining now. Okay, it sounds scary.
I can understand your concern. Yeah, but I want to tell you that this investigation is very important and very crucial in making the diagnosis. So it's my advice that you should accept doing this investigation because it will help us to make your diagnosis.
Doctor, what are the risks which are associated with this procedure that you are telling
Uh,
me?
Adam, I can understand your concern. There is no surgical procedure without risk. The possible risk may include there is bleeding from your teeth while inserting the endoscope. There is a possibility of infection such as chest infection, and along with that, there is bleeding. Sometimes there is a bleeding from the lining of the food pipe from where we take the sample. And the most serious complication is sometimes there is a cutting through the wall of the food pipe, and which may need surgical repair after that as well.
And there is 1 in 2000
The risk
chances.
is 1 to 2,000.
Yes.
Yes.
Oh, doctor, that sounds really, really scary now. Now I do not want to go through this procedure. Is there anything other alternative that you can offer me?
I can understand your apprehension, and I can see that you are worried after listening this. But listening to these risks doesn't mean that it will happen to you. And it's my advice that to accept doing this investigation, as I told you before, that it is very important and very crucial in making the diagnosis. And I want to assure you that only the experienced and the skilled surgeons are allowed to do this investigation. So it's my advice to accept doing this.
Doctor, how would I know if there is a perforation like you told me?
So as I told you before, that the chances of this perforation is very less, like it's one into 2,000. But if we suspect perforation is there, so maybe there is a pain after the investigation. And maybe if we're suspecting that you have pain in your tummy, then we will do an X-ray to look out to find out that is there any perforation is there.
All right. What are you trying to say? Do I have cancer?
Uh, Adam, I can understand that you are worried. It is valid, but it is very, very early to say that you are having some kind of cancer. Because first of all, we need to do this investigation, and after that, we need to wait for the results. And there is a possibility that maybe we need to do some other test as well.
Doctor, why do I keep on salivating?
I'm so sorry for hear that. I can understand that it must be very distressing to you, but this salivation that is due to there is a narrowing at the lower part of your food pipe, which actually hinders the secretions to go down.
And there is dribbling. Okay.
That and that's why there is a
Okay.
dribbling of saliva from your mouth.
All right. Please tell me, would I be awake throughout the procedure?
Uh, there are two possibilities, but first of all, I will arrange a consultation with our anesthesia persons. So it could be under so we call that it is could be under general anesthesia or it could be under sedation. So in general anesthesia, you are completely you are sleepy. You will not recognize what's going on. While if it is under the sedation, then you
Yes.
feel drowsy, but you know that
Yes.
what you will remember a little bit, but you feel drowsy and but you feel no pain about that.
All right. What would I eat during this procedure or before this procedure?
As we have to see your food pipe, so you are not allowed to eat anything the 6 hour before this procedure, and you can take only clear liquids 2 hour before that. Otherwise, you are not allowed to take any food or 6 hour before the procedure.
Okay. And how long are you going to keep me at the hospital? When can I go home?
Adam, usually we will discharge you once you regain the consciousness, and it will take around 2 to 4 hours. But you cannot be dry for the next 24 hours, and you need someone who will take you to the home.
Okay. And what about the medications for my blood pressure? How can I take that?
For your medication, there is no restriction. You can take your medications till the morning of this procedure with a small sip of water.
All right. Okay.
So let me summarize that what we have discussed so far, that we need this investigation, and this investigation is under GA, and I have already explained you all the risk and the importance of this investigation. And if you agree, would you need to sign this consent form? Would you please
Okay.
sign this consent form for me?
Yes, I'll sign them.
So Adam, we all are here to help you and support you. And if you have any inquiry, do not hesitate to contact me. I will leave my number with the nurse for you. Thank you so much for your understanding.
All right. Thank you.